Lagos. Good evening, Africa. Come on, I need a bit more energy in this room. Good evening, everyone. I'm Folly Bah Thibault, Senior News Anchor at Al Jazeera, and I'm thrilled to be your moderator for the final panel of the night. I think it's safe to say that we're all feeling pretty inspired tonight, aren't we? Yes? Let me hear it. Well, now it's time for us to talk about how to turn our inspiration into something tangible. There is no singular way to bring about change. Whether you're an entrepreneur, a researcher, a politician, or a journalist and education advocate like me, we each have our own ways to contribute. And tonight we're fortunate to hear from two people who are both accelerating progress. They don't just talk about change, they drive it. With them, we'll talk about a real-world example of impact, the transformation of Gombe State's primary healthcare system. What elements make partnerships effective and sustainable? And lastly, what role you can play in creating a stronger and more resilient Africa. I'm very excited to introduce our panelists to you. Our first one is one of Nigeria's most stalwart champions of health. Under his leadership, healthcare in Gombe State, northern Nigeria, has become more affordable. The number of trained healthcare workers has increased, and childhood and maternal mortality have declined. Our second panelist, yes, just wait. Our second panelist has helped lead one of the most impactful philanthropic organizations in the world. The Gates Foundation has worked in partnership with African leaders, organizations, and scientists for the last 25 years. As a result, we've seen incredible gains across multiple sectors of the continent and are set up to drive progress even further. Ladies and gentlemen, please join me in welcoming to the stage His Excellency Inuwa Yahaya, Governor of Gombe State, and Mr. Bill Gates, Chair and Board Member of the Gates Foundation. Please. Join me. Bill, you sit right here, and the governor, yes. Yes, you sit there, and the governor will sit right there. Thank you so much. Thank you, gentlemen. We are very much looking forward to your insights tonight. Thank you for joining us. Please, a round of applause once again for our panelists. So, Governor, let me start with you, because your background is not in health, but you've become one of the most vocal advocates for primary healthcare in Nigeria. Why did you decide to focus on primary healthcare transformation as a central focus of your administration? What sparked the commitment? What was it? What story led you to decide to pursue this?
Thank you very much. And let me begin by giving the background.
Yes.
And as politicians, you know, we normally go around campaigning before eventually become chosen to be a governor or elected to be governor. And such promises normally align to the hopes and aspirations of the people. And you must prioritize and see that you are able to address. And when I became governor in 2019, my promises to people were mostly tied to, you know, human capital development, because we're performing very low in the indices around that. And as such, I realized that going through the primary health care would have helped me achieve a lot in quite a short time. And so I had to work with the indices I found and see that I effectively utilize, you know, in order to encourage the health workers and the health system to go in line with the earnings and aspirations of the people. And the statistics I found were really very low.
Right.
And for example, attendance or attention in primary health care was not obtained 100%. In fact, it was just about 53% in the state. Access to primary health care, that is, access to secondary health care was by far much higher, lower than expected. 90% could not access basic secondary health care with ease. And our immunization coverage was just about 18%, and there was only 3.5% release in the budget in order to finance health expenditure. And also, there was a multitude of out-of-school children, around 550,000 or so by the account of UNICEF. So there was so much that I now felt I had to prioritize and face both health and education. In order to tackle health, focus on primary health care became very imminent. And then I had to focus on getting to the people in the right places. And we are tempted by having to do with upgrading the primary health care system in not less than 114, which are the wards we have. And that I was inspired to do so because of my attendance of the Seattle, round table, which agreed to do one primary health care center per ward, per political ward. So because of that, I tried to see that work in Gombe, and we stripped all those 114, and now we've upscaled to 2. So we have now 2 primary health care centers per ward. We did supply all the basic requirements of the hospitals, from electricity to water.
You took a big risk at the time because a lot of people at the time were playing it safe.
Oh yes, but I had to do so because I had to take that bold decision. Otherwise, I would not have achieved my aims and targets, getting to the people and building hopes in them and inspiring them to follow me as their own leader. So that enabled us now to improve on the situation and the statistics as it is today. Coverage of immunization is around 50%, and access, that is, to primary health care has also increased because now we have about 45%. And besides that, we equally have all the infrastructure needed around the health sector.
And a decline in maternal and
oh yes,
mortality,
obviously, because it's not only the resultant effect is not only in just attendance, but child mortality, maternal and child care has improved, and also mortality has reduced, and also the impact of the operations of the primary health care centers has reduced, absenteeism, and the staff are well motivated and they're doing much better than we wanted them to do.
But I'm sure, a round of applause for the governor, please, for everything that they've achieved in Gombe State. But I'm sure there were challenges along the way, which we'll address in just a moment. But Bill, let me come to you now. You've announced a landmark commitment, pledging to spend $200 billion over the next 2 decades, with a large portion of that focused on the African continent. That deserves a round of applause, I think. Because this is happening at a time when there's a great deal of concern about the declining levels of foreign aid, right? Especially to the African continent. So Bill, I think we all want to know what inspired you to do that, and how will the foundation ensure that this investment strengthens local institutions and avoids dependency, that it's not charity?
Well, the Gates Foundation got started in the year 2000, and the basic guiding principle was that all lives have equal value. And so I was curious to understand, why do children die? What do they die of? Where do they die? And it was pretty stunning to find out that the chance of a child dying in northern Nigeria is 50 times greater than in a rich country. It's one of the, for a place without war, it's one of the worst places in terms of child survival and maternal survival. And so I looked and I said, okay, are people taking this seriously? Are they making the medicines cheaper? Or are they tailoring the medicines to the particular needs of those areas? For example, investing in new malaria tools. And the answer was no. And so that became the guiding light for the Gates Foundation. Over 70% of what we've spent, the $100 billion we've spent in these last 25 years, went to global health. And throughout that 25 years, we've developed deep partnerships throughout Africa, here in Nigeria. We've had amazing partners who understand the delivery, the way that we can work and help government. Government in the long run has the responsibility for all of this work. We're there to accelerate these systems. It's very exciting that if you improve health, it actually accelerates the economic growth of a country. And eventually, we've seen with Asian countries that invest in health, they grow their economy, and eventually they get to this middle income status, and they're able to be basically self-sufficient. These next 20 years, the countries in Africa will get to that status. So helping them accelerate that, helping understand, okay, what are the unique local challenges? Which things do we need to make simpler, bring the price down? That's done as a partnership.
Right.
And the last 25 years went way better than I expected. That is, the childhood death globally and in Africa was cut in more than half. We went from almost 10 million worldwide to now less than 5 million. And I feel confident we can cut that in half again, even though, as you mentioned, right now, we're in a stunning and completely unjust withdrawal of support from a number of rich governments, including the United States. But even despite that, which is going to make the next 4 or 5 years, we'll have some reversal because it's just too large and too sudden to overcome. We will get back to incredible progress reducing those
I was going to ask you how big of a reversal and what's the timeline? What timeline do you expect to continue making that progress again?
So the number of children who die every year has gone down faster every year for the last 25 years, over 3 times faster than ever in history. And, and there's some, very key things that were done there. There were new vaccines that were made cheaper, like rotavirus, pneumococcus, penta. And Gavi is a group that helps fund most of those costs to make sure they get to all the world's children. So that alone, the bed nets for malaria, the preventing HIV transmission from mother to child, a little bit of progress on malnutrition, although that will be a big thing in the years ahead. So all that came together, and people started looking at vaccine coverage, and various countries can compare their vaccine coverage. There's some countries in Africa that have over 95% vaccine coverage, better than the United States. There's some countries that only have 50% vaccine coverage. So quite a range that if we spread best practices, we can do.
So that there is hope that we can still make progress even if there's a decline in the coming years.
Taking the best ideas from all over Africa and sharing them, that alone would be a gigantic thing.
Right. Governor, Bill talked about challenges that are unique to the local context. Talk to us about some of the challenges that you face while trying to transform primary health care in Gombe State and how you push through these challenges.
Well, considering the location of Gombe State and the nature of the terrain, we face challenges, especially with the basic infrastructure, be it the roads, water supply, electricity, and also facilities that are needed in order to manage successfully the primary health care centers. 2, the attitude of workers, especially those located in the rural areas. There's a lot of truancy, and because of absenteeism, and sometimes to the extent that some of them are even ghost workers, and eventually they may generate to become ghost pensioners. So extra efforts need to be made in order to keep them on track. And for that, we had to be ingenious to start using biometric machines to take attendance and monitor the performance of our health workers in their various locations. So there is also an issue of funding, because the challenges of today are normally tied around finance. The budgetary allocation to the health sector was only about 3.5% at the inception of my government, but I now added upscale to around averagely between 2020 until now to around 8.5%. So we're trying to reach the national average, and those are really helping us in catching up and making the situation better. But above all, what is most important is to ensure that at least whatever little you have, you utilize it properly, and you align yourself with partners that are able to understand your system and give you the support you need in order to succeed.
Yeah. So, Bill, you heard about some of the challenges there. They're real, and the urgency to act is high. Are you hopeful that Africa and Africans can still deliver on these big health goals? And what do you believe needs to happen now to make that happen?
Well, certainly, Gombe is an exemplar, really focusing on the performance of the workforce and being willing, even with very tight budget conditions, which is true throughout Africa, to emphasize not just health, but specifically primary health care. And we see very quickly when that's done, the childhood deaths go down, the maternal deaths go down, the nutrition rates go up. We heard earlier about how AI is coming along, AI which is improving at the global level, and AI which is being shaped specifically by entrepreneurs in Africa to meet African needs. And so if you take the combination of, Africa will be getting richer as the years go on, there'll be more philanthropists, the rich countries will restore some of their generosity. And on top of that, the sharing of best practices and the innovation. We have some incredible tools coming along, even for things like sickle cell disease that, right. We need to get rid of that. It's a dramatic burden. So when you combine the innovation and the growth that we'll see, global excitement and amazing work being done here in Africa. Yes, if you look at this 20-year time frame, we can achieve even more than we did in the last 25 years.
That's impressive.